Hello all, I would like to discuss the topic elderly in Kerala and fear of fall. Coming to introduction, Kerala, the southernmost state in Kerala, which is highest in the literature index and healthcare uh, provision, is passing through the most critical stage of demographic transition termed population aging. By the term population aging, it is meant that the number of persons, that is the aged persons in the state, is progressively increasing, and if such increase in the elderly population will put burden in the healthcare provision as well as the healthcare expenditure of the state. And as per the 2011 census, the senior citizens in Kerala were 41,93,393, and according to a study conducted by Center for Developmental Studies in 2013, the state's elderly population is growing at a perpetual rate of 2.3%, and the disability survey conducted in 2015 found that there is 42,33,474 elderly in Kerala, and it comprises around 12.36% of the population, which is highest among the Indian states, and it is at par with that of the developed countries. And fall, which is a sudden transition in the body which result in a person reaching close to the floor, will cause a lot of injuries, and the highest morbidity and mortality of fall related injuries occurs in elderly who are 65 years and older, and community dwelling elderly, those residing in the houses, are found to have injuries due to fall, especially around 50%. In the elderly, fall risk factors include impaired gait, that is change in the walking pattern due to the changes in the muscle strength in the lower limb, especially muscles of the thighs and ankles, and also due to impairment of balance due to the changes in the nerve structure, nerve degeneration, and the slow reaction time. And a combination of these factors, that is impairment in gait as well as impairment in balance, will lead to fall. Also, another factor which causes fall are the environmental factors, which include the uneven walking surfaces, dingy or lighted areas, and wet floors, etc. And also kinky areas and crowded places, and places where the pavement has not been kept properly will lead to fall. Fear of falling is another factor, fear of falling is nothing but a person feels that he may fall. And another factor is self-efficacy, that is how confident a person is that he can do his everyday tasks without causing fall. These two factors, that is fear of falling and self-efficacy, influence the incidence of falls, and it seems that 1 out of 4 elderly is reported to be having fear of falling. Reduced muscle strength, flexibility, which is associated with aging, as we have discussed earlier, along with postural changes, lead to fear of falling even among those who have not experienced any fall. And fear of falling seems to be doubled among those elderly who had fallen previously. And fear of fall will lead to increased distress and reduce the quality of life of the elderly, and in turn it will lead to increased medication use, and they restrict the activities to reduce fall, which in turn will decline their physical functioning and heighten the risk of fall. And next, what can be done to prevent this fall and fear of fall? First of all, we need to do assessment of the elderly. They need to be assessed for the balance, gait, posture, sensation. Their environment also need to be assessed. Next, we need to provide reassurance for the elderly regarding fear, to address the fear and other depression and other aspects. And balance training, even among the elderly who have not experienced fall, seems to be very helpful to prevent fall and also fear, to address the fear of fall. Initially it can be done by a therapist, and later it can be done by a caregiver as on a ongoing process. And strengthening, especially of the muscles of the thigh and ankle, also help to prevent fall. And environment modification like clearing the pathways, providing a lighted environment, especially during the night time, and removing carpets and other disturbances in the pathways will definitely reduce fear of fall and fall. And counseling support to address the fear of fall and other psychosocial aspects. And peer trainers, especially those empowered elderly to handle and train the fellow elderly, seems to be very helpful. So, coming to summarize this, fall and fear of fall is gradually increasing, especially in a state like Kerala where the elderly poor segment is increasing. Strategies to address these issues is of utmost importance, and hence adequate measures should be taken on an immediate basis. I would like to acknowledge Mary Elizabeth Tidia Walding for her continuous support, and Swayam Mook on academic writing for the inspiration and guidance. And regarding the feedback about the academic learning course, it was very useful. It widened our knowledge, and it's extremely helpful in academic presentation, especially poster presentations, paper presentations, thesis preparations, and publications, especially journal, as well as in sharing inputs in public domains. Thank you.